bone cement. It's a synthetic material common in use for fixation. It has viscoelastic properties, exhibit creep and stress relaxation, good in compressive strength, poor in tensile and shear strength. Uses: number 1, fix as a grout rather than adhesive. Void filler in non-malignant lesions, osteoporotic vertebral fractures, revision THR and TKR, and muscular technique, while for infection with resection of bone. Ingredients: the liquid consists of methyl methacrylate monomer, and dimethyltoluidine accelerator, and hydroquinone as inhibitor. The powder form has polymer, polymethyl methacrylate, opacifier barium or zirconium dioxide, initiator as benzoyl peroxidase, and antibiotic as aminoglycoside, and a dye as chlorophyll. The antibiotic used should be thermally stable, wide spectrum, long eluting time 6 to 8 weeks, and not compromise mechanical stability. The process by which it mixes is called polymerization. Reaction is exothermic reaction and energy inefficient. Carbon to carbon double bonds are broken down and new single bonds are formed with long chains that are linear and relatively free of cross-linking. Phases of cement setting. Mixing phase, 52 seconds for low viscosity, 50 seconds to 2 minutes for low viscosity. Then this is also similarly called sandy phase. Then doughy phase, from mixing until cement become non-sticky. This process, after that, it is working phase. Working phase is implantation phase and end of dough phase to beginning of setting phase. Increased temperature, increase mixing and handling reduces working phase. Then is hardening phase. Implant should be kept still as cement becomes hard. Then is setting phase. From mixing till it reaches maximum heat, in vivo temperatures are reported to 40 to 56 minutes. At this time, draw a line called sandy till 2 minutes or mixing phase. Then draw a diagram showing a doughy phase. Then another line showing working phase ending at 7 minutes, and then hardening phase for 24 hours. Type: low viscosity, long doughy phase. Medium viscosity reaches doughy stage later than high viscosity, and high viscosity, which has a short doughy phase. Optipac is closed vacuum system. Simplex is a medium viscosity, high fatigue strength, and low creep, that is plastic deformation. It has 1 gram tobramycin in it. Pelacos is a high viscosity, green dye, shorter waiting period, and extra long working phase. It R plus G has gentamicin in it. Pulse lavage reduce risk of fat embolism. Vacuum reduce the porosity to avoid crack propagation, and pressurization to enhance interlock of the bodies of the cement interface. Cement implantation syndrome consists of hypoxia, hypotension, cardiac arrhythmias, and cardiac arrest. Cause is not fully understood. Several mechanisms. Number one, methyl methacrylate monomer mediated model. Number two, embolic model. Number three, histamine release model. Number four, complement activation model. Number five, multimodal. Recommendation of BOA. 3 stages and 3 processes to reduce the problems with cement implantation during hemiarthroplasty. Number 1, identification of patient with high risk of cardiorespiratory compromise. Number 2, preparation of team and identification of roles in case of severe reaction. Number 3, specific intraoperative roles. Surgeon role. Inform the anesthetist that you are about to insert cement. Thoroughly wash and dry the femoral canal. Apply cement in retrograde fashion using cement gun. Avoid vigorous pressurization of cement in high-risk patient. Anesthetist. Ensure adequate resuscitation pre and intraoperatively. Confirm with the surgeon that you are aware that you are preparing and applying cement. Maintain vigilance for signs of cardiorespiratory compromise. Aim to have systolic BP 20% of pre-induction time, and prepare vasopressors in case of cardiovascular collapse. Barak whiteout criteria. A is complete whiteout. B is radiolucency less than 50%. C is more than 50%. D is 100% radiolucency.